Hi everyone, my name's Belen and today I'll be talking about workplace ergonomics. Using ergonomic science, occupational therapists can help their patients participate fully in their jobs. The field of ergonomics studies how people perform and feel about their surroundings, tools, equipment, and jobs. Enhancing worker health, safety, and productivity while also increasing workplace efficiency is the primary goal of ergonomics. The context and activity demands of a job can be matched with each employee's strengths and limitations to increase worker safety, productivity, and efficiency. Numerous problems relating to the workplace are addressed by the ergonomics principles. Workplace and work process design, stress at work, older and disabled workforces, tools and equipment design, architectural design, accessibility, and body mechanics are common issues. When issues arise, ergonomic intervention can be used reactively to modify the fit between the worker, the job, and the context, or to proactively prevent problems before they arise. Ergonomic concepts are widely applied by occupational therapists in their client-centered comprehensive rehabilitation or wellness and prevention program. Some occupational therapists pursue careers after specializing in ergonomics. Concerns regarding handling materials center on back injury and include lifting, pushing, pulling, bending, and twisting. So these are some things that you want to avoid. The heavier the material, the more risk for back injury. Low back injuries are seldom the result of a single traumatic episode, but rather the result of repeated microtrauma that ultimately leads to injury. So that's why body mechanics is very important with jobs that demand pushing, pulling, bending, and twisting. Therefore, workstation and work process design becomes integral for the safety of materials handling workers. The optimal choice depends on the kind of work being done. For tasks requiring fine assembly and writing, as well as when all necessary supplies are easily accessible within comfortable arm's reach within the seated work area, seated workstations are ideal. So, for example, if you're doing desk work or office work, items handled at a seated workstation should not weigh more than 10 pounds or require the hands to reach more than 6 inches above the work area. Because of this, when performing precision work, the work surface height should be higher than elbow height. All types of work tasks can be performed at a standing workstation, but they are ideal for tasks requiring downward force, such as packaging and wrapping, and frequent movement of multi-level reaching around the work area. Over 10-pound items should be handled at a standing workstation. For heavy work, the work surface height should be 4 to 6 inches below elbow height. For jobs that require both sitting and standing for certain tasks, the combination sit-stand workstation works best. Training in proper lifting technique and proper body mechanics is important to promote worker safety. Design workstations to keep large items that require lifting off the floor. Providing platforms that will keep items at mid-thigh height to allow workers to stand nearly erect for lifting are good ideas. Some other ergonomic principles include providing foot clearance so that workers can get close to the item as possible when lifting, and face the load head on. Adjustable tables are excellent for this purpose. Objects should be against the torso during the lift to minimize force on the spine. So for example, if you're lifting something, you don't want to hold it away from you. You want to keep it close to you to reduce back injury. Workers should never be forced to twist their torsos to lift an object. Use carts or conveyors to transport heavy materials instead of carrying them. Orient packages for easy pickup and provide adequate handles or handhold cutouts on packages. So these are all some ergonomic principles that we can teach our clients, but it's also important for us as occupational therapy practitioners to implement these during our sessions as well, whether we're working with the patient or handling equipment in our work area, as well as even doing our notes. Want to make sure that we're seated in the proper position and not reaching too far out of our comfortable reach in order to prevent back injury, which is the leading cause of injury in the workplace. That is all. Thank you.